Welcome to the Health Promotion Center at Mid-City Church of the Nazarene. I'm Cindy.
And I'm Roxy, and we work here as nurse externs, and we will be orienting you to the clinic in this video.
The HPC is a free clinic that serves adults here in City Heights who are undocumented, uninsured, and would otherwise be unable to access basic preventative health care. Our clinic is open Tuesdays and Thursdays from 8:30 a.m. to 12 p.m.
Here at the HPC, we offer free physical exams, including basic blood work and other labs, TB tests, and many other supportive services like referrals and stress management.
The majority of our patients are Hispanic, and many primarily speak Spanish. Although speaking Spanish is not a criteria to volunteer here, you will be definitely asked to utilize any Spanish you may know in order to communicate with our patients.
We're glad you're here to volunteer. Watch this video for an orientation about your role here as a volunteer. We hope that after watching, you'll feel more familiar with our daily routine and your role.
So this is the entrance to the Health Promotion Center. We have signs that we're going to be closed, but disregard those. We're going to do a tour inside. We'll just kind of walk through quickly. You want to follow me through the door? So here is this is the waiting room for patients when they come in. So they pick a seat. They generally come here, say hi, tell you what they need generally. Over here we have a couple pamphlets if they want information about anything. They can grab it right here. So this is a supply room. Anything we may need restocking will be in here. If you need anything else, you can always let us or one of the nurse practitioners know. This is also the room where we do mental counseling and stress management. We'll do education in this room sometimes. We have a fridge in here, so you'll find waters here as well if we need that restocked. We're gonna enter the clinic now. If you wanna follow me. Okay, when you come in, on this side is the front desk. We have the computer, of course, is where we put in appointments and everything. We have any kind of paperwork that we need to fill out here. Printer doesn't work. New charts making here. We sit here, and then this is the bathroom, of course. And then over here we have the lab. Patients will generally sit here, paperwork. Most of the cool stuff happens here. And in this room, we do our devotion in the morning. This is generally where you'll find the nurse practitioners when they're charting or speak to patients sometimes. On this side, you'll find charts of patients. So you'll find them alphabetically ordered, and they're labeled, so it's easy to find patients. If you can't find them, sometimes they're up here if they're using them. And sometimes you might find them scattered. But we also have some on this side. They're kind of the older charts. If you can't find it in that one, you'll find it here. This is also labeled and alphabetically ordered as well. Follow me over here. So this is where we generally do our eye exams. Printers. On this side, you'll find exam room number 2. So generally, we like to use this first because it's a bigger, kind of gives a little bit more space for the patient. Across the hall, you'll find exam room 1, which also connects to a second room back here. This is the offices of Mary Margaret Rowe and Amanda. We don't really use this room that much, but it is here. You will see it. Past this room is our little break room in a way. This is where you will find the signs that lead to the HPC from outside, and we will show you how to set those up in a bit. And then this is where we can also have lunch. If you bring a lunch, we have a mini fridge here, and we have a couple spoons, anything you may need. I'm Cindy, coming to you live, and I'm here with our lovely volunteer, Natalie Bain. So Natalie, what is your favorite thing about being a volunteer here at the Health Promotion Center?
Thank you, Cindy. Thank you, Roxy. My favorite thing is getting to work with the nurses. I think the nurse-physician relationship is really important, and it's important to learn what role the nurses play in providing healthcare and how that role differs from the physician. It's also important to learn how to effectively communicate with your nursing coworkers. My other favorite part is getting to use Spanish so much. My medical Spanish has improved, and I love serving these people in this community, being able to serve them within the context of where they live and work and where their families are. So yeah.
And how much Spanish would you say you use on a daily basis here?
Well, I use it whenever I'm educating people about diabetes, whenever I do patient processing, and in the examination rooms if we're trying to figure out their family history, or if they're trying to figure out what they're talking about when they're talking about certain problems they have. That's when you use Spanish a lot.
Last question. So Natalie, what advice would you tell an incoming volunteer?
I would say to just keep an attitude of open learning, be flexible in whatever jobs that you're asked to do, be calm and collected. Doesn't help anyone to freak out when different situations come up. Be thoughtful, always be ready to look up information or to think alongside the nurse practitioners or nurse externs, and just enjoy your time here. It's a unique experience and not a lot of people get to do these things firsthand, so enjoy it.